Are you a business owner that could use just one more customer? Those empty tables, vacant appointments, idle employees, and expired merchandise are missed opportunities. What if there were a community that connects you to high-value and motivated customers, giving you a competitive edge in the marketplace and increasing your revenue? Introducing Partners One. You keep doing what you do best, taking care of your customers, and we'll do what we do best, sending you new customers to take care of. Call us today to find out how Partners One can work for your business.
Welcome to the Rocket Right Show, starring Hurricane Betsy Barnes and Dr. K. Solar. Two busy blondes with their fingers on the pulse of all things Louisiana. Events, health, leisure, entertainment, and more. It's the Rocket Right Show. And now, here's Betsy and Kay.
And welcome to Rocket Right. We are so glad you can be with us. We are having a good time, as always, coming to you from the Partners One studio in beautiful Baton Rouge, Louisiana. But you can hear us all over the place. You can hear us in Texas.
That's right, because you're so loud, Betsy.
No, Louisiana, that's right.
I'm teasing.
That's right. We're having a good time. So we're really excited that you could be with us and that you could join us. And we're excited you, Dr. Ron McMorris, could be with us. We always love it when you come. We always learn something from you. So thank you for being here.
Thanks for having me. And we're going to be having with us Dr. Ralph Dotrieve coming up next, who is the Vice President of Medical Affairs at Ochsner Medical Center here in Baton Rouge, because there's a lot of myths out there about the COVID-19 vaccine. People want to know, it's like, what's really going on in the hospitals? I mean, are we really like busting at the seams? What's happening? He's going to tell us the truth, what's happening in the medical system, and talk about some of those myths that are concerning for folks or misinformation. Never in history has anyone gotten their medical advice so much from social media.
Right.
And so you really have to think, is that a legitimate source? How do I vet that? And so we're going to be talking about all those things.
We want the truth. We want it boiled down. We just want the truth. No sensationalized stuff, just the real truth.
So we're going to be talking about all of that. And then we're going to have a little music to end the show with Connor James. So, yeah, fun times ahead. Thanks for hanging with us. It's always fun time to start the show with you, Dr. Ron.
Thank you. Thank you. It's always great to be here.
Yeah. Dr. Ron has My Elite Chiro over in Walker
and Albany.
And Albany. Let's not forget that.
Conveniently serving all of Livingston Parish.
Mm-hmm. So what you want to talk about today? We have talked about the expansion of your clinic. You've had so much going on.
Partnership with ACE Physical Therapy. You brought your friend with you last time, your friend and colleague, and he was very enlightening in the things that he shared. And
he had a great time. He enjoyed it. You know, I think the big thing to get out is if you hurt, if you say ouch, call Elite Chiropractic, call Cam Wellness Center. Let us check you out. Let us see what's going on. There are many times to where chiropractic isn't the right choice for your pain. However, we have great relationships with the physicians in the area. We've seen the referrals, the results from different referrals. We know who to send you to. So instead of wasting time jumping from doctor to doctor, come to the experts of the musculoskeletal system. Let us send you to where we know you're going to get great care. And again, it doesn't matter if it's something that we specialize in or you think we specialize in or not. We can get you to the right place.
So you're good at helping with the diagnosis.
Absolutely.
And then referring you to the right place. You don't want to just crack and pop and adjust everybody.
Well, we don't crack you back, Betsy. We wine and dine your spine.
Exactly.
and Betsy likes whining and dining.
That's right.
Just saying.
That's right.
Just saying. So I do like that.
You're right there with me, Kay.
Oh, hush up, you.
But you really are about people's whole health.
We are. We tried. We've been in business now. We've been in Livingston Parish since 2010. I grew up in Livingston Parish. My daughter is going to grow up in Livingston Parish. My entire family's in Livingston Parish. We actually live about 15 minutes from everybody. Yeah. And Livingston Parish is my heart. When I lived in Baton Rouge, Texas, I was talking to my dad about moving back, and we had a few choices of where to move to, and I chose Livingston Parish. I love the parish. I love the people, and I want to continue to give back as much as we can. It's not just a business that's there. Every patient's like family. We go to church there. We give back to the community. We participate in the community events. It's really special to my heart to be there, and I'm glad to be able to provide the services we provide. And then over the course of 10 years, 12 years of being there, since 2010.
Yeah, time
there's
flies,
certain,
doesn't it? These last couple of years just disappeared.
That's right. They do. They just, look, I tell people I clock in on Monday mornings, and when I clock out that evening, I realize it's Friday. So, Mom and Dad said life was going to pass by fast when I got older, and here it is. It's flying by.
Yes, it is.
So there's certain things that we just don't specialize in. And, physical therapy is a great alternative to some things that we may not be able to provide. Several things we can't provide. Yeah. So for those needing specific treatment for physical therapy, we now have a nurse practitioner and an MD that come in. We'll be providing different types of services for them. We'll talk about that on the next show.
Okay, that sounds good. You always have something new adding to the
right.
practice, and you do have one of the best massage therapists.
Oh, she is
think
phenomenal.
That there is. She's phenomenal.
Yep, Dawn's phenomenal. She really cares about her patients. She takes her time. You don't feel rushed when you're going in.
And what is her full name so people can call and make an appointment with her?
Elite Chiropractic in Walker Albany.
Not your
and ask for Dawn.
Dawn.
That's
okay.
Right.
We want to make sure that people know that that's who they need to go to, and that might be the beginning of their journey with
He's
you.
got the one girl there. You just call and ask for a massage, and you're going to get to the right place.
We do have Holly. She practices in our Albany clinic as well. Holly is great. Holly does a fantastic job. We just see more patients in the Walker clinic. But, I started CAM Wellness Center. So the next time you go into Elite, you'll see Elite and ACE. You'll see us advertising a lot of CAM Wellness Center. And what I was looking for is the wholeness approach, looking at the whole person and, what services are maybe outside of my scope of practice, but I knew, the patients deserved it. So instead of traveling to Baton Rouge, they can get the service right there in our clinic. Anything we don't provide, there's another great nurse practitioner, Christine Palmer. Christine Palmer has a more natural approach to healing. She's doing IVs with vitamins and really doing some great, amazing things to help with the obesity problems we have in Livingston Parish, the opioid problem we have in Livingston Parish.
That's a serious problem everywhere.
Absolutely. And just providing care to patients that they haven't had before. So now Christine's not in our office. She has her own office in Walker. But between her clinic, my clinic, the other massage therapists that practice in the area, the other physical therapists, chiropractors, we're really providing great services to Livingston Parish. Chiropractic is the one profession I found where if you have a bad experience once, you don't go back. If you have a bad experience with a plumber, you call a different plumber. Have a bad experience with an electrician, you call a different electrician. I've talked to several people who have gone to one visit, had a bad experience, and like, I'm never going back again. We'll just choose a different one. So, or go back to the same one, give them the experience, let them know what's happening, because 100% of the time that you hurt, you have inflammation. 100% of the time. So when we do an adjustment, we're doing something different to the body. We're causing a potential or creating a potential for more inflammation. So although the problem might be fixed, the inflammatory response may feel like you're worse, and the problem was better. Go back and communicate with your chiropractor. Tell your chiropractor what happened, and let them adjust their adjustment. Let them adjust what they're doing.
And maybe they need to stretch a little bit, drink a little more water. Maybe they need a little nutritional guidance.
Absolutely.
I mean, there's a lot of things that play into that recovery and healing.
In the future, we're going to have a doctor of naturopathic medicine. We're going to have nutritionists, speech therapy, occupational therapy. We're going to have it all right there in Livingston Parish for patients to go to.
It's so much easier when you go to somebody you trust and they refer you to other people they trust. It's just so much easier.
I've always liked the fact that you put a nutrition component in it, because so many people, they have inflammation or their joints hurt because they're overweight and they're overworking.
They just have such a poor diet, their body doesn't get what it needs.
So when you add that nutritional component to help with your overall health, you ultimately can reduce your inflammation. And
I wish the government would focus more on programs to decrease obesity, decrease smoking, increase
all
your health.
All
instead of giving $100 to get vaccinated, or $100 for this, or $1 million for this, instead of providing extra services or keeping people from working. I really feel like if we'd focus on a better health care. We really don't have health care in the United States. We have disease care. You go to the doctor when you have a disease and you ask for it to get fixed. If we had health care, we'd have more healthy people and less people dying from COVID.
Absolutely,
yes,
because what your general health status has been shown to be whether you have serious complications or not from COVID. And I think one of the big take-homes from what's been going on with COVID is how can I personally improve my health so that I'm less likely to succumb to this? Not just and so the vaccine, we're going to talk about that. It's preventative and
It's not
may help you
everything,
reduce that. But it's just like, the person who's a diabetic who's 400 pounds and they keep eating a pint of ice cream every night and taking a shot of insulin to reduce that. You need to look at the whole picture and everybody's whole health. It's not just a quick fix. It's like a lot of things.
Well, food is medicine if it's the right food.
That take, and it takes a lot of willpower. Some people, don't want to have that personal willpower to improve their life. But those that do, some people just don't realize how important it is, I think.
I think the problem that we have is and I know this from experience. This is my personal experience. I felt the government was pushing something on me. If it was so great, why do you have to push it on me?
Right.
So it really turned me off. I wanted to make my decisions in life. So it wasn't until I talked to a good friend of mine who told me the CEOs of Pfizer, Moderna, these companies, they didn't just dream it up. All three CEOs, the different CEOs, they didn't dream up RNA one night at the same time. This technology has been around, and I just posted on my Facebook a study from Duke University in 1993 is when the RNA vaccine or RNA medications became more popular or more readily available. So go to my website, Ron McMorris. That's not my website, it's my Facebook. And my Facebook, Ron McMorris. I have a pretty decent post. We have people posting some links, and I usually leave after a show, but I definitely want to stick around here what Dr. Dotrieve has to say.
Absolutely, because he's going to tell us all about that. And I know, it's one of those things, you want to make your own decision, but you want to get it from the right sources. You looked into it and made a decision.
I made a decision. I feel like I'd survive the COVID. I feel like I'm healthy enough, but what would my family have to go through?
Right. So you went and
I put my family first.
Yes.
Yes, always.
And so we are going to have Dr. Dotrieve up next to talk more about any questions you might have that's rolling around in your head, because we've seen them all on social media, and he's going to answer that about the COVID-19 vaccine as well as what's going on in our hospitals right
That's
now.
right. Stay tuned.
Ladies.